Olá, boa tarde a todos, bem-vindos a mais um CEBRI Online. Eu sou Carla Duarte, diretora adjunta do CEBRI. O nosso evento de hoje vai tratar da gestão pública e a crise global da saúde. Eu vou passar agora para o inglês para os nossos convidados poderem nos acompanhar. So, good afternoon, everyone. I'd like to start by thanking our partners for this event, Instituto República and its Executive Director, Eloy Oliveira, and the Institute for Health Policy Studies and its Executive Director, Miguel Lago, who is here with us today and will help conduct the event. Thank you both for helping us put together this event in a crucial moment for the sanitary crisis in Brazil. The idea here today is that we discuss on different public management approaches to the health crisis in countries that have chosen very different paths, very different strategies to deal with the situation since the beginning. So Brazil, Italy, and Argentina. From our side in Brazil, we have Francisco Gaetani, who is the chairman of the board of Instituto República. He is also a former executive secretary at the Ministry of Planning and at the Ministry of the Environment. From Italy, we have Guido Bertolaso, who is a medical doctor, and he's also a special consultant for the Lombardy region in the COVID-19 emergency. He has also a very long experience in the public sector dealing with national emergencies. And joining us from Argentina, we have Dr. Carlos Javier Regazzoni, who is also a medical doctor, and he is the director of the Global Health Committee of CARI. CARI is the most important international relations think tank of Argentina and an important partner of CEBRI for a very long time now. So it's a pleasure to have you all here. Thank you for accepting our invitation. I'll now hand it over to Miguel, who will conduct our event today, and then I'll come back at the end with a few questions from the audience. Miguel.
Hello. Thank you so much, Carla, for this introduction. Thank you so much for organizing this event for us at the IEPS. It's an honor to be partnering with CEBRI and with República. I would like to thank as well Eloy and all his team for gathering such an amazing panelists for this discussion. So I would love to start with some questions. I know that many things gather Argentina, Italy, Brazil. We have many commonalities between us. The most important one, of course, is football, but certainly we have other commonalities. But clearly, the three countries responded differently to the pandemics. The three different countries have different health systems. So I really would like to ask each one of you, and starting with Italy and then Argentina and then Brazil, to evaluate a little bit how each country responded to the coronavirus crisis, and how is their evaluation, and based on which strategies did the governments fight and address the humanitarian and health crisis. So let's start with Professor Guido, please, with Italy.
Your audio is muted.
Now it's okay? Can you hear me?
Absolutely.
Great. As I said before, I see that my internet connection is a bit unstable, so I do hope that you will be able to hear me properly, and just to follow the few statements that I can make just at the beginning. Is of course for me a pleasure to be with you and share views about this incredible problem that we are facing everywhere in the world. Just to talk about Italy, you know that my country has been the first country in Europe to be affected by this outbreak, this epidemic. Just at the end of January, officially speaking, then during the last weeks, rumors and ideas and speculation have risen, saying that probably we had this problem since the last autumn or last December. Nobody exactly knows, because we don't have now ways to check properly what really was the problem during December, when in some regions of the northern part of Italy, a lot of people, mostly elderly, just came to visit the first aid department of the different hospitals with pneumonia, very severe pneumonia, which was not the typical kind of bacterial pneumonia that doctors were used to see. So probably already at that time, we were facing troubles with this virus. If it's true that the last information about the spread of this disease just say that this problem was not just a problem at the end of December in China, but they already were facing this kind of problem even few months before. So, by the way, the official statement, the first emergency declaration made by the Italian government, the Council of Ministers, took place on January the 31st, when the emergency state was declared by the government according with the civil protection law, just because of the risk of a very severe epidemic of COVID-19. But at that time, to be extremely frank, nobody was very afraid about this disease. There were a lot of statements from even important virologists and important medical doctors in Italy that were saying that the influenza, the flu, was much more dangerous than this COVID-19 epidemic. Just making a kind of comparison between the number of deaths that has occurred in Italy during last year for the flu and with the comparison of the number of deaths that were reported by Chinese authorities and by the Wuhan authorities. Even myself, to be extremely frank, I was very skeptical about this kind of the possibility of spreading the COVID-19 in Europe and especially in Italy. Although I am a medical doctor with great experience in epidemic, I spent 3 months in Sierra Leone in Africa during the Ebola epidemics, working with the local authorities as a medical volunteer just to help them in dealing with that incredible, terrible problem. So the vast majority of the Italian scientific world was not very worried about this problem at the end of January. And that was still something that we continue to discuss even during February, not taking into account the different information that we are just getting from, again, from Wuhan and from the World Health Organization, especially. And we didn't act promptly. We didn't start with, the procurement of course, of CPR, of mask, gloves, and all the other equipment that were then during the month of March badly needed everywhere in the world, and so very difficult to find. And the other problem, the biggest problem in our country, is that the health sector, although is a very public, is extremely decentralized. In all the different regions in Italy, everybody can manage the health sector as the region decide to deal with. The central government has just the role of a kind of a coordination activity, kind of a guideline, but is not in a position to strengthen the local, the regional health system, where the regions are totally, in a way, self-sufficient, totally independent. They can organize their health sector as they wish. And that is the biggest problem, because we, during the month of February, we lack, sharing information between the different regions from the northern part of Italy and with the central government. And when the first positive cases occurred, especially in Lombardy, they didn't share this kind of information with the central government, and even they, in the hospitals, they were not very ready in being able to make the proper diagnosis against this kind of problem. The first cases that just went to seek advice and help the first aid department in the hospital near Bergamo and the hospital near Lodi in Codogno, they were treated at the very beginning as a normal, simple pneumonia, while they were positive to the virus, and so they spread the disease to the different medical and paramedical personnel and to those who were, just around them. And that has been the biggest cluster. Two places in the northern part of Lombardy, in Bergamo, and in the southern part of this region, which is the region probably one of the most, if not the most important region in our country, with 10 million, more than 10 million people living there, and with the industrial sector, of course, which is the most important sector in our country, with a lot of relations with China because of their business activities. And the first decision taken by the central government when they started to understand the severity of the problem was to close all the flights between China and Italy. But as we know very well, is something which is totally useless, because you can fly from China to Italy via Frankfurt, Paris, London, and all the other hub in Europe. So just doing that kind of decision was just not enough, was not sufficient to deal with the problem. While, I say again, in Lombardy, the first week were wasted in trying to organize a proper system without making the only important decision, which was taken only at the end of February, when the government realized that they had a cluster of this infection near Lodi, and they decided to establish the first red zone, but only in that area. While in the meantime, the dissemination of this kind of infection was taking, place everywhere in Lombardy, even in Veneto, in Piemonte, and then in the southern part of Emilia-Romagna and the central of Italy. When they decided to close, to do the lockdown for the country, the 8th or the 9th of March was too late. We used to say that we closed the gate when the cows were already outside. And so it was a decision which has been taken too late, but it's been the only wise decision that has been taken by the government. With another...
Dr. Bertolaso, since
Please.
you're talking about lockdowns and the fact that Italy took them too late, I would like to just pass to Argentina and talk a little bit about Argentina and how Argentina managed to impose a national lockdown very early in mid-March. And just some figures here. So the COVID arrives in Latin America in the end of February. The first death confirmed is in Argentina on March 7th. And when we look at Argentina, we have around 500 deaths. And we look at Brazil, we have 25,000 deaths. So it's Argentina is a mystery, and we all want to know exactly how did you implement a full lockdown, and how was this possible, and what are the effects, negative and positive effects about this?
Okay, well, the national government of Argentina is following a plan with 4 parts to manage the pandemic. The first part is social distancing, among which is, of course, the most important is lockdown. The second is a testing program. The third is a healthcare capacity upgrading. And the fourth is a social and economic support program, a very wide program of support for poor neighborhoods and poor people. Social distancing is under a national plan that establishes many phases according to the days of doubling of cases, depending on how many days take the new cases to double. Today we are in phase 3. In phase 3, what implies a differential measure according to geographic sector. Perhaps we have provinces that now are allowed to selectively ease confinement measures under National Health Authority approval. So provinces must ask the central government whether or not they could ease confinement measures in some specific activities. Of course, the stricter measures are taking place in the Buenos Aires city and the surroundings, which are the most affected. The duplication time for the country is now around 10 days. We are doubling the total cases in every 10 days, which is one of the lowest in Latin America, despite the fact that it is clearly accelerating. When you look deeper into the poor neighborhoods of the city of Buenos Aires and the shanty towns of the surroundings, duplication time is taking 7 days, and probably it is also accelerating. Regarding testing, there are two separate actions. There is a national decentralized strategy based on official definitions of suspicious case. These are the cases that are going to be submitted to the PCR. And then a special strategy for poor neighborhoods in the city of Buenos Aires and the shanty towns surrounding the city of Buenos Aires. What is happening today with the testing strategy? Argentina performed real-time PCR to patients with the definition of suspicious case. And that implies always symptoms. So we don't have a strategy to test asymptomatic patients. That explains a lot of failures of the program right now. So we, beyond any doubt, we underestimate the real cases in the country because we do not test asymptomatic patients. Even we test symptomatic patients only if they have 2 symptoms and an epidemiological context. Something that in many neighborhoods now they are trying to change it because we know that we are missing too many cases. Today, Argentina is the country of Latin America with the lowest 7-day average PCR per 1,000 population in Latin America. We perform 0.08 tests per 1,000 population per day. That is more or less like Brazil. Brazil is a little bit above us, but it is 1/10 of the work of Chile, the half of the work of Uruguay, and 5 times less than what is testing Peru. About healthcare capacity upgrading. Now a country with 44 million population, we have 4,500 critical care beds units with mechanical ventilation. Just to make a comparison, Germany, with the double of our population, has 40,000 beds, 10 times more. The case fatality rate right now, which could be seen as a measure of your healthcare capacity, is 3.6%. Of course, it is a half of Brazil, you have 6.8%, and less than the half of Ecuador, which is 8.7%. But it is substantially higher than all other countries in the region. So why we have now the rate of occupancy of our critical care bed units is less than 5%. Otherwise, we have such a high mortality, case fatality rate. That is the second question. The first one is, as I have said, we are beyond any doubt under detecting. And the second one is why we have such a high case fatality rate when we are far from an overwhelming the healthcare support facilities. Regarding social and economic support, public transfers reinforced of previous transfers, subsidize to businesses to pay salaries. Well, all that implies 2% of our GDP, even though we foresee a 18% contraction of our GDP this year. Remember that we come from 3 consecutive years of recession. So for our country, it will imply probably 2 or 3 or 4 million new poors in the country in the next year. Public clearly shows ambiguous sentiments regarding the confinement measures and economic damage. And that answers the recent question of what you have just asked me, Miguel, how people is bearing with the confinement. 60% of this population answers in surveys that they support confinement, quarantine. They support the measure. But 60% of the population, the same, say that they are extremely worrying because of the economic calamity they are suffering. President Alberto Fernandez now enjoys a consensus of 60% of the population. And also his decisions are supported unanimously by all the governors of the country. So political consensus is near total in the country. Reopening of the economy, that is a problem, is being guided by the current federal distancing program. So it is based on the time COVID takes to double. So the dilemma, and this is the last thing I say in order to give it a place to Mr. Francisco Gaetani from Brazil. So this is like a World Cup football match. Italy, Brazil, Argentina, the best in the world. What we see is this dilemma. Quarantine, we are approaching the 70 consecutive days of quarantine. People is becoming really crazy and extremely poor. Everybody is getting in bankruptcy. Has been undoubtedly successful, but the upgrade of healthcare capacity is not enough. Testing has been undoubtedly underperformer. So we estimate, the Imperial College estimates that we have detected only 15% of the real cases that we have in our community. And the country is becoming in bankruptcy. And because of the feeble, the weak testing approach, now we have a rampage numbers in the poorest neighborhoods of the country, the same neighborhoods that were unable to keep up with the quarantine, and we are absolutely, our economy is exhausted. So the future is, or we change, it is my opinion. Of course, this is not the opinion of the government with which I am discussing these days. My opinion is that we must change our strategy. Otherwise, we'll die either because of the virus or because of starvation. Thank you.
Thank you so much. This gives a very different picture from what we're seeing here in Brazil, especially in terms of political unity. And so I'll pass to Mr. Gaetani to comment a little bit about the situation in Brazil. Why is it so different from Argentina?
Oh, thank you, Miguel. Thank you for the opportunity to share these thoughts about the crisis. Well, beginning with your question. Things began in Brazil with a communication problem. The president sent a message to the country that it was just a flu, that we should not be concerned with, in the critical moment that we realized that the virus would arrive. And this initial message produced a lot of confusion. Since the very start, there was a divergence between the health ministry, the health policy community, and the command of the executive. This confusion remains until today. So our strategy has been the confusing strategy, The population is divided and is misguided about what's happening. I think that we should think in terms of 5 dimensions here. The first one is the virus. It has 2 features that they were new for us. It spreads fast, the contamination is fast, and it evolves fast in the critical case also. So we are not prepared to deal with none of these features. The second point, which also I think that we should take into account, it's about state capacity. When we talk about Europe, Italy, France, Spain, Portugal, Germany, these are nations in which their state is relatively structured, professionalized, modernized, consolidated. This is not the case in Brazil. We have a very mixed picture in our public sector, and our public management reforms are historically a sort of unfinished business. And health is not an exception. Yes, we have our national health system. It's a motive of proud of us, but I would not say that our health area is professionalized, fully professionalized yet. We are sort of the middle of the road. We have a good institutional arrangements, but our personal management, it's a problem. It's a sector clearly underfunded by all international standards. Also, we have the use of the resources is also a permanent object of criticism. How we have corruption problems in procurement transactions. Today, as you may know, we're facing today and yesterday, another national scandal involving Rio de Janeiro related to procurement transactions for procurement of equipment in the health for fighting coronavirus. So when you talk about state capacities, in terms of the number of beds available in the hospitals, the public sector is fine, but the public sector is not at all, as you can see in states like Amazon, Pará, and Maranhão, where our public capacity already collapsed. The third thing, which is a word mentioned, it's politics. What does politics have to do with this story in Brazil? Everything. The issue was politicized since the very start. Instead of getting the country united above political divergences, it became an arena, ideological problem, a political war commanded by the president, which is also does not help. Fourth, this is clearly a communication problem. You have to fight the virus and you have to fight the communication war. Again, we had the country split between the executive, the judiciary, the governors, the mayors, the medical community, and the civil population. So the communication is very confusing. The press has done a very nice work trying to inform, trying to organize the information, but we don't have leadership. We don't have a common narrative, which again provokes lots of confusion. And finally, which is strange as it may well, we have also in the political dimension an international angle. Our president tried to attach itself with the United States narrative about the virus, which makes things even more confusing. And regarding the economic situation, like Argentina, we have been in a kind of endemic recession for 5-7 years. And at the end of the day, the crisis, we're caught in the back foot regarding the crisis. And we have a Minister of Economy that does not like state intervention, is more concerned with fiscal austerity than with a kind of provision of health public sectors as the country needs. So we couldn't have a worse situation to handle the crisis. But again, in terms of initial impact, we had more time. So presumably we should do more. And the governors, the mayors, the private sector and the third sector are trying to improvise what they can. We're not a country well known for its anticipation and planification capacity. We tend to move in a very short-term reasoning, but at least the civil society and the private sector, as well as subnational levels of government, are trying to respond with the resources they can. So it's a very confusing situation. As you know, we're becoming the epicenter of the global crisis. we are overcoming the United States soon. Obviously, some of these problems are not particularly Brazilian. If you look to the shape of the curves, you'll see Russia, Mexico, India, they're coming also, but we are still in the leadership of the situation in a negative way. Why? Because we really don't have a national strategy. Today, we have our Minister of Health militarized again. We had 3 ministers of health in 1 month. This is not helpful. Obviously, the military can help, but they are not experts in this subject. The president is declared war to the United Nations agency, like the United States president did. So we are having to find different ways to handle an unprecedented crisis. That's it for a while.
Thank you so much, Mr. Gaetani. So moving to a second question that is more to all of you. I mean, so one of the common characteristics that we can see is that the response of the crisis, both the humanitarian, sanitary crisis, but also the economic crisis, is led by the state. And my question here is, do you think that there's already a change of perception about the role of the state and how the population perceive public administrators, or do you see any kind of change in the perspective and the perception of people towards the state and the role of the state and the role of the public servants?
I think.
Please, Dr. Bertolaso.
Okay. Can you hear?
Yes,
yeah?
Absolutely.
I think that we are running the risk to miss a great opportunity, in Italy at least, because you know, we have to make a kind of differentiation between the state and the government, of course. The state is something different. And people, the Italians, they look at the state as those who are a civil servant, those who are medical doctors, nurses, technicians, those who are, you know, the law enforcement responsible person in charge, those who are just in a way, they guarantee the services just to let the country still live and go ahead. Another issue is, of course, is the government, and so is the political world. Those who, in a way, should lead the country in a very difficult situation. And although, as happening in Argentina, even in Italy, the Prime Minister has never met such a huge consensus as during these days. There is, on the other side, less trust on the behavior, on the activities of the government. It is a very strange situation where the Prime Minister, who is seen as the one who is running, who is managing this kind of dramatic situation, is seen as someone who is doing a good job, and he has more than 65% of positive, you know, consideration from the Italian people. But the other ministers and those bureaucrats who are in charge for the management of this emergency on behalf of the government, they are seen as people who doesn't kind of. The same happens at the regional level. As I said before, Italy is divided, you know, is decentralized in 21 regions. And the president of each region is playing his own or her own role in dealing with the emergency from the communication point of view and from the different activities, especially in the health sector, that they are responsible for. And so even in that situation, we see some region which played a better role and a better fight against this disease, who are now seen as the next leaders for the country as well. Like while other regions like Lombardy, which is has been, as I said, the most important region and the one mostly affected by this problem. The management, the government of Lombardy today is seen as those who are responsible for the failure of the activities just against this disease. This morning, the president of the Lombardy region has been put under protection from the law enforcement responsible because he is got a lot of criticism, also, you know, kind of, can I say, you know, minacce against his life. So it's very tense, the situation. On one side, the state has played an important role and is gaining more consideration than before. But I'm talking about the civil servant. Those who are on the first line played an important role in the hospitals and in the provision of different services. Trust on these people is very great. Time, one of the most important magazines, as you may remember, has put on the first page of a few weeks ago the photo of one of our medical doctors involved in this kind of activity. And so though they are seen really as the leaders against this fight. What is extremely strange is that those who are seen today like our heroes, those who have even lost their life, because we have the terrible record of more than 165 medical doctors who died during the last weeks because they got COVID during their professional activity in the hospitals, which is another failure from the government and for our country, because that means that they have not been protected as they should have had the right to do, you know. And so they are seen again as our heroes, but at the same time, they are those who are very badly paid. They are those who will bear the responsibility of mistakes that may be they are making with patient, and they are those again who are not protected in the best possible way against, you know, the possibility of getting the virus. So it's a very mixed situation with the state seen as a leader, but not with the politician, but with those who are playing the first line activity. And with the politics, which is seen today, the politicians, which is seen today in Italy, once again as those who are just making a lot of fight between each other. There has been a unity and a common attitude in our country during the first weeks of the epidemic. But today, this, you know, this climate, this situation of national collaboration has already broken down, and they are playing again their role as before. So this is the picture of my country today on this point of view.
Thank you, Dr. Bertolaso. I'll move forward then to Mr. Regazzoni, if you could add something.
Okay, well, I mostly agree with what here in Argentina is happening, something like Dr. Bertolaso has just said. I would say that there are two challenges or two dilemmas. One is among the politics, and the politics are under threat and also are challenged by the question how to survive. Because even though they currently enjoy unanimous or near unanimous support, they know that they face the real possibility of extinction of the political class, facing a public demanding, and when the death toll rises, you know, outcomes are very, very blurred. So the temptation under such a threat is populism and a kind of demagogic behavior that could be very, 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 very dangerous for the other dilemma. How works the state, the policy-making dilemma? Policy-making is also under threat and also challenged because of this public crisis in two fronts. The fiscal side of the state, so how are we going to pay the bills? There are two possibilities: growing or taxation. You know which one of them politics will choose. So we go for the side of taxation, undoubtedly, raising taxation. And the second challenge, not fiscal, is how to make the state useful. So the state we have had until now, is it the appropriate state first, to battle against the current crisis, and second, to overcome the crisis and to envision and foster a new future? Well, that is an open question. Of course, now in the country, there is starting to be a huge debate, most in line with the international debate that is now taking place around the organization of the new state that we think we should foster, we should promote. But there is a third term that I have to mention, the heroes, as Dr. Bertolaso has just named, the healthcare workers, security workers, and all the public officials who, even risking their lives, bus drivers, as the international experiences show, they are risking their lives in order to serve the public, in order to keep the country still working. Well, there is a commonality, a common feature of all these heroes. Invariably, they are the worst paid civil servants in the country. So now we are in hands of the worst paid civil servants in the country. The justice system, judges, prosecutors, they earn 3 or 4 times above the highest medical salary in the country. So the director of a hospital earns 1/3 or 1/4 of a judge. Judges, they are all at home right now. And doctors are all in the battlefront. So my message is, I doubt seriously that kind of inequality will not have political and, of course, also policy-making consequences in the near future in a country that will plunge, like the region, in poverty.
Thank you, Dr. Regazzoni. Very strong statements, and you're absolutely, this is a reality in many of our Latin American countries where we value more bureaucratic figures than necessarily those who are saving lives. So, and I'll move forward to Dr. Gaetani, please.
Well, the response in Brazil also have been very contradictory. Begin with the president. In order to try to send a message to keep things normal, he has supported public demonstrations every Sunday morning in Brasilia, promoting public acts in a moment that everybody's trying to support social distancing. He's personally involved in sending an opposite message. In terms of the economy, the government provided in agreement with the Congress a huge package to support states and municipalities, as well as $100 monthly support for low-income people. And most of the private sector engaged in home office arrangements, mechanisms, in order to avoid the need to go to work. The impact in unemployed has been huge, depending on the sector is devastating. Some sectors are extinguished. Others, they will have to see how they will evolve in this new context. But the critical issue regarding the response that they are not coordinated, they are not synchronized, they are not agreed by all players. The street level bureaucracy, as Guido mentioned, in Brazil, the first line of defense, it's already collapsing the public sector, as predicted. It was predictable. Why? Because first, on the contrary of the developed countries, especially in Europe, the baseline of state capacity in health services, it was not ready, it was not there. So when we talk about flatten the curve, nice, but you presume that there's a baseline that will absorb the impact if you flatten the curve. Again, even the areas in which we're managed to handle the crisis, it's very tense. It's a permanent stress test. Why? Because we don't have this capacity required. The responses vary a lot depending on the state of the end of the capitals of the country. We're talking here about a big country with multiple situations. Amazonas is gone. It's just gone. The impact is absolutely devastating. São Paulo, we have a very dramatic situation. Rio, the honest answer is that we don't know because of the data problem. We have a serious problem of underreporting. We know that it's serious. We know that it's complicated because we have the favelas, but it's one of the worst situations because we have 3 different strategies: executive, state, and municipality, and we don't have data. So that's another problem. Underreporting has been a major problem in many countries. The illness became stigmatized as a sort of bad thing, as the person were responsible for being sick. So this is really sad. But back to the street level bureaucracy problem, we have to talk about teams. We have physicians, doctors, nurses, their assistants. These teams, they are failing. They are failing. Why? Because they're becoming sick. They're the first to get sick. And we are not planning to replace them in the speed and the quantity required. Again, we are very short-termist people, and we have not been able to anticipate the crisis. One of the challenges we're facing now is to improve the quality of the partnerships with the public and private sector. We need to bring the private sector on board of this process. They still have some empty capacity to manage to support to handle situations. We are expecting the worst, as you know by the numbers. We're not in the peak. If we will have a peak, we are not there yet, and we have to find ways to bring the private sector on board. This week, the Senate is voting some arrangements that make feasible the use of private capacity to handle the crisis. But it has been different initiatives not coordinating because we don't have a leadership of the whole process. Again, as Carlos mentioned, we have to discuss the recovery. We know that you have to be inclusive. We know you have to be digital. We know you have to be green, but that's not really the case now. We're still entering the crisis. The unemployment in Brazil before the crisis was 12, 14%. Now we just don't know. And we are in a fog. Because of the data problem, we are improvising responses here and there. And we hope that we will be able to, through this different initiatives from society and subnational levels of government, to manage the situation and to overcome it. But we need to unite us. If we don't change this behavior, this divisive, conflictive behavior, this war behavior, we don't know what will happen. This is not a health problem. This is a political and social problem, and we depend heavily on the mobilization of the society to act differently. We have to unite the country against the illness, against the virus, otherwise it will stay with us for much more time than we expect.
Thank you, Mr. Gaetani. My last question, then let's move to questions from the public that I know that Carla has some questions, but I really wanted to ask you something. We've been discussing a lot about state capacity and the state capacity to face this crisis. But there's also an important part of leadership there, and Mr. Gaetani was telling a little bit about the case in Brazil. But I really wanted to ask you, what is the importance of political leadership on top of state capacity, or is state capacity enough to face such a crisis of this dimension? I'll ask, please, Dr. Bertolaso to come first.
Let me, okay, can you?
I think you have muted yourself, Dr. Bertolaso. Can you unmute it? Yeah, thank you.
It's okay. Let me just, concerning what we said, what said Mr. Regazzoni, what I also said before about medical doctors in Italy and Argentina, which are very badly paid. There is a joke in Italy where we used to say, okay, you are sick, you got COVID-19, huh? Okay, go and be treated by Cristiano Ronaldo. Instead of, you know, the medical doctors who get just one, you know, how much? 1 hand, just a small, a little bit of, you know, the amount of money that we pay to the, since we talk about the world football. I think that this is something that stress again the need to deal with the leadership is extremely important. If you want to solve, to manage this emergency, you need really good, strong leaders with a very good capacity of doing communication, to just take a decision quickly after having heard everybody, and to show the capability of running the country in the best possible way. Everybody in Europe today talks about Ms. Merkel, who is now playing a role as a leader in her country after some times where she was not seen as the leader that she has been before. Now she's playing a very good role of leader. Leader is the one who just plays his role on the front line from my point of view, or mine. You know, I, just a medical doctor, when I was asked to work as a coordinator for the establishment of a COVID hospital in Lombardy with 200 ICU beds, since in Lombardy they didn't have enough number of ICU beds to deal with this kind of problem. One of the first things that I decided to do was just to go around the different hospitals in Lombardy to shake hands with the doctors and nurses that were on the front line. And I got the virus. I spent 2 weeks in the hospital with COVID-19 just because I decided to, you know, be the one very near, very close to those who were were risking their life in order to deal with this problem. And our politicians, even the government, have spent all these months in their offices. They never went out until last week. And they never decided to go around and meet, you know, doctors and those who were working on behalf of the state in the regions, most affected regions. They played their role, very afraid to get anything, and so they just work, you know, in the way that we are working today. But if you work this way, you are not the leader that the people are looking for. The leadership is, from my point of view at least, an important component on the fight against this disease. And in Italy, if you ask today to the Italians, who is the person that you recommend against this, you know, in charge for the fight against this problem, against this epidemic, they may say that the prime minister, but they, before just giving this answer, they will have to think a lot about. Today, they don't have someone who is the focal point, the real leader in this situation. And this is one of the problems that we are facing today in order to move from the first phase to the second phase.
Thank you so much, Dr. Regazzoni. Do you want to add something?
Yes, you know, we all are waiting for a change of mind. So we all agree the world is in disarray. We all agree the world nowadays is unjust. So we know, we also know that it is our fault. At a certain different degree, it is our fault. So we all know and well knew that we have to change our mind. But to change the mind through a political process is not easy, because political processes are not designed to change minds. Minds change by two ways: education or a crisis. Education, Latin America has the lowest standards in the world in education. The last report of the PISA Institute was really disappointing. In 15 years, the evolution of education in Latin America, except for some very specific points, was really disappointing. So are we expecting that we are going to change our mind because of education, when education is clearly far behind the international levels nowadays? The second one is crisis. And I see that many people is expecting that this crisis, that is one of the major crises, is going to make us to change our mind in order to be able to change the way we live, we coordinate, we cooperate, and we make politics too. Let me give you a piece of advice that comes from history. In 1918, everybody was expecting a change of the mind because of two things: the First World War and the tremendous pandemia of gripe española at that time. Many works of art. At that time also came the Red Square Revolution. So the world was really convoluted, convulsionated. It was a disarray far worse than today. Minds didn't change. The 20 years that followed until the next World War were the worst 20 years in the last 3 cycles of the world. So we do not have to have too much expectancy in that our minds are going to change because of this pandemia. Personally, I think that this is an opportunity in order to advance ideas of new leadership, because the ears of the people are open to listen to new ideas. And I celebrate many new ideas that are going all around the world, because nowadays the international debate is really becoming very, very interesting. We know neoliberal politics are no longer going to take place in order how to provide a welfare state. We know that the world is going to grow less than the decades before. We know that the financial system is not going to help underdeveloped countries as Argentina at least, and many other South American countries, and Africa too. So there is an opportunity to change, but change is not going to happen as an art of a wizard or an art of magic, you know, because experience is really, history is really very disappointing. A catastrophe, like what happened in the first half of the 20th century, was really disappointing in its results. So let's think about new ideas. That's my message.
Great, Dr. Regazzoni, thank you so much. Mr. Gaetani.
Well, regarding political responses, I'm slightly more optimistic, because I think that we have observed in Congress an impressive, timely response. Some state governors, like the Rio Grande do Sul governors, an exceptional response. Some mayors, like my city's mayor, Belo Horizonte, same thing. What's the difference? those who have responded properly, they have dialogued with the scientists, with the academia, with the doctors, the physicians, the nurses, and they try to do their best. Obviously, science is not a synonymous of unanimity, but you can't declare war to science, as our president has done. You can't declare war against the academic community. Same story. Our ministers of education and of health, they are in a state of permanent war. We're not going anywhere in playing this game. Fortunately, Brazil is a big country, very heterogeneous, very diverse, and we think that different segments, different parts of the community, of our civil society, of political system are responding properly. They don't have the resource available, but they are doing their best with what they can. This is a reason of optimism, but we have to seize the war. We have to concentrate on the problems, on the real problems of health, and postpone the political problems. Otherwise, we will make the crisis worse. That's in fact what's happening. We are doing things worse than they would be. And I'm not talking about uniting the country anymore, but at least we can stop the war and try to let some people do their jobs. We need also comprehension. This is not only on the president debt. Brazil, because of the crisis that we have faced in the last years, everybody wants to run the country. The judiciary wants to run the country. The public prosecutors want to run the country. The Congress wants to run the country. The Court of Accounts wants to run the country. It's really impossible. We need to stop the war, this political war, on behalf of the country. That's the best political response we can give. But on policy terms, the federal executive has to change its behavior. If it does not change, worse for the society. But at least at state level and local level, I think we're doing our best. We arrived at the current situation. It was a collective effort, a tragic collective effort. We are the ones to blame for our situation now in Brazil. And only we can react against the situation. In order to reverse the situation, we have to change our behavior. And this affects everybody, not only the chief of the executive.
Thank you very much, Mr. Gaetani. So, Carla, do you have some questions from the audience?
Yes, we have a few questions here. And to this point that Mr. Gaetani was talking about, I'd like to bring a question about that's directed to Dr. Regazzoni, but I think it will be to all of you. So how much of Argentina's success is due to the political coordination between federal, state, and municipal level, despite being from opposite political sides? That's the question to Dr. Regazzoni that I would like to extend to both of you, Dr. Bertolaso and Gaetani, to ask how do you see that the coordination or the lack of coordination between these levels is affecting the managing of this crisis in Brazil?
Yes, in Argentina, everybody is absolutely in awe, absolutely astonished because of the coherence of the political sector. So the politicians, we all agree with the policies. There are minor misunderstandings, but not at all. But that is also a problem because we do have agreement, but we don't have a strong disagreement. And in order to work, a country needs both things, agreements and disagreements. And perhaps some events of deeds of corruption, very, very, very dangerous and very, very ugly that we have seen with medical devices in the last month, and also with the food for poor people. The public debate around them, about them, was not strong enough. And many, many difficult solutions that are underway right now could enrich and would be, deserve a better outcome if there were more disagreement than agreement. That is a problem of the crisis. So we all celebrate that we do agree the most essential politics in order to fight coronavirus. Population also supports. Those are very, very good points. But we are starting to see the problems of a kind of lack of disagreement. And that is, that could become dangerous in the near future.
Dr. Bertolaso, please. You were muted.
Okay.
Yes.
Being in the health sector very decentralized, the coordination between the regions and the central government was not easy. At the very beginning, the central government decided to play a leading role and try to give instruction and guidelines to the different regions. Some of them, they followed this kind of guidelines, others they didn't. You must even be aware that in Italy, the half of the regions, they are run by political parties which are against the central government, and the other half of the region, they are the same political parties which are running the central government. So even this problem, different political views, different political commitments, was another problem in trying to coordinate among the different regions. But even regions with the same political government, like Lombardy and Veneto, they didn't coordinate at all between them. And so Veneto played a very good role since the beginning with the testing all the symptomatic and the asymptomatic cases, with the tracing all those who were, close to those who have been positive, has done, a proper tracing everywhere, and has tried to protect all the medical doctors, and made a very good approach on the rural, on the field level, while Lombardy played a totally different role, trying to stress mainly the management of the central hospitals instead of doing the testing of all the symptomatic and asymptomatic, and even the tracing was a failure in Lombardy. So they didn't exchange views, experiences, and they didn't even change problems. They followed the guidelines from the central government when it was a good way for them to show that they were doing something for the people. But from the real point of view of trying to work as a team, the central government, the regions, the provinces, even the different municipalities has been, unfortunately, from my point of view at least, one of the mistakes that we have made during the past months. Now we are trying to play all together for the opening of the second phase, which is extremely important, especially for the economy and the social situation in our country. And we are trying to play all together a better role in order to start at the same time in all the different regions and try to decide which kind of policy we have to establish in the most important sector like education, not only in the retail or in the other sector, but education is in our today the priority for our country. And in that way, at the moment, there is at least an effort to coordinate all together. We will see in the coming weeks what will really happen.
Thank you so much, Dr. Gaetani.
Oh,
You
so
have
far
mentioned a few, comment a little bit about it.
Yeah, so far it has not happened. It's never too late to begin to come to senses and do the right thing. But I don't see it happening so far. At state level and local level, also we have some fights, some difficulties, some conflicts. And we are, in some states, you're having more cooperation, other less. It depends also on the change of the mood of the country. Carlos mentioned that you need mindsets, you need to people to see things differently. If you don't stop the polarization, this sort of new way of doing politics and to behave, if you don't really have a rational discussion about the problems, you need disagreements, but you don't need hate. You need to process your differences, to overcome them and to come with a new solution and move on. The whole world is in the same page. In Brazil, apparently, we don't move the page. We are with several books open, but we are in stalemates and impasses because we refuse to process our disagreements. We refuse to clarify our positions. We are replacing policy debates for emotions. We are replacing proposals, programs, programmatic ideas by feelings, for feelings. This is not a way of doing policy, doing politics. Our country will not move on if we don't change. And in order to change, probably we'll need a doses of crisis that we are not prepared to handle. So apparently so far we are digging, we're still digging. We are all digging. And if we don't stop digging, I don't know where we will arrive. The coordination, it's a challenge. Some sectors are coordinated themselves. Logistics is a good example. We have a novelty in this context, the strong and sensitive presence of the military in the government. It may be a sword with double. We don't know exactly what will happen. We have more than 1/3 of the cabinet is for military. It's constituted by military. They are good professionals in their own areas, but they have a way of working which is more hierarchical. Maybe they can help, but they can't replace politics. And we are on the verge of facing conflicts that we need a lot of politics, a lot of different behaviors. And instead of stridence, instead of yelling, we have to discuss, to learn again how to discuss and process our differences. Otherwise, we will not overcome, not the coronavirus crisis, but we will not overcome any crisis. We need to change, and change hurts.
Carla, you're muted. We can hear you.
Sorry, our event is coming to the end now. So I'll pose a final question so you can make your final comments. And the question that we have received is, what are your conclusions on the main lessons learned from the beginning of this process? And for Mr. Gaetani, what do you think are the best practices Brazil could learn from other countries, especially from Italy and Argentina? And if you have any final comments, please feel free.
Well, we're very proud of the Argentinian president. That's the first comment. The second comment is that despite all their problems, Argentina spends with their health sector, the public expenditure of Argentina in this area is the double that Brazil expends in the public sector, the double, twice. And the statistics about physicians and nurses, same story. Here in Brazil, it's not the moment to discuss this, but we can't handle our needs with the corporatism of the physicians profession we face. We need to open this market. We need much more physicians and nurses than we have. The third is that I'm sure that the population is trying to do their best in supporting the country against the crisis. So these are the three lessons that I'd like to recognize and to accomplish Argentina for their performance. With respect to Italy, we were all shocked here about what happened in Italy. Sad and suffered a lot. But again, the country is reacting, and is reacting against a situation that was unprecedented with the means they have. They try to do their best, the street level bureaucracy in Italy, but also reacted with civism and culture. These are two very important forces to handle a crisis. We saw here many examples, and we think that we try to learn with how the populations in the cities are changing their habits, are doing what they can to keep the country floating. Obviously, Italy will have a serious problem with tourism, which is by far one of the most important sources of revenue of the country. And we hope that in many ways, we'll learn what we'll do, because it happened before in Italy. We hope to learn how to survive and keep life moving on, because life goes on, and there's no country like Italy to teach us about it. And we're looking forward to see how we will do it. We think that coronavirus will not go away soon in Brazil. It will move around the country. And we don't expect to be out of the bush in 2 months, 3 months. Maybe Italy can help us to handle this situation, despite the difference of both countries. Thank you very much. It was a huge pleasure, and I learned a lot.
Thank you, Dr. Gaetani. Dr. Bertolaso, do you want to add something? You are muted.
I do believe that Italians have been extremely good during the lockdown. Much better the Italian citizen than the Italian members of the state of the government. The Italians, for at least for once, have shown to be a real nation altogether, following the rules and regulation of the lockdown. And this is why we see the end of the tunnel in front of us, and we believe that we'll be able to start again during the coming weeks in a much better way, although we don't know, as everybody else in the world, what will happen in the coming months, during autumn and during next winter. But we are trying to organize, and I think that we can overcome this problem with the famous 3 T's: therapy, tracing, and testing. If we do that, on the really at all level in our country, and we are trying to organize to do in that way, I think that we'll be able to face the problem in the coming months, waiting for a vaccine or for drugs, which, in my humble opinion, will not be ready so soon as many people say. And the other, I think that, by the way, the most important lesson that we have learned is that we need an international organization really in charge with this kind of problems. This experience has shown that there are no borders, and that the virus can go everywhere where it wants. And I do believe, having been an international civil sentence as well in New York, I do believe that the World Health Organization has to be reorganized deeply if we want this kind of organization as the leader for the future. Otherwise, it's better to look forward in other ways. Let's try to work for another international organization who has to be the leader, the focal point, the one who just has the leadership in dealing with this kind of medical health problems, because it is out of question that the world is going to face troubles like this one in the coming years. So let's try to be ready in order to face the problems in the future.
Perfect. Thank you so much, Dr. Bertolaso. Dr. Regazzoni.
Well, I agree with both, with Dr. Francisco Gaetani and with Dr. Guido Bertolaso. I do agree that we need a new or a renewed global health organization in order to coordinate not only this pandemic, but many other non-contagious diseases whose roots are also global. But in this moment, we know that even though healthcare and science are probably some of the most universal values in the world, even though we know that after this pandemic passed away, that is going to happen in the next months, biotechnology, science, and the endeavor for global health will be stronger. We should see with skepticism the possibility of a new global order, because precisely after this pandemic, there are 2 other lessons that we have to regret about. The first, Globalization, as we understood it, is going to also probably disappear, because we are seeing that when we need most unity, we see most disunity.
Yeah.
So that will challenge also global health organization, or the organization of global health. And the second is poverty. We don't know how many people will die, but we know certainly that at this very moment, many, many millions of people will get poorer than before, and economies will be weaker. So maybe that the near-term lessons that we'll take from this bitter experience could enlighten our present actions. So bear in mind that healthcare is still a universal endeavor, that solidarity feelings should enlighten our political actions, and that science is and unity are undoubtedly the resources that could bring more prosperity to our world.
Thank you so much, Dr. Regazzoni. Miguel, would you like to add something before we end it?
No, just thank you to our amazing panelists and for this very interesting discussion. And I'm pretty much sure that our Brazilian politicians need to learn more with the Italians and with the Argentinians as well. They should perhaps listen less to the Giovinezza and start listening more to the Marcha Peronista. Thank you so much.
Pero el próximo tiene que ser en portuñol e italianol. Ahí va todo.
Así es.
Thank you all. Thank you for your time, your contributions, and thank you, Miguel, again for the partnership. Thank you, Eloy. Thank you, Francisco, for the partnership of Instituto República.
Saludos.
Bye, people.
Saludos. Chao, chao.